Hi, I'm Bruce Fine. I'm a GYN oncologist at Medical City, Dallas with Texas Oncology. I'm going to talk to you today about signs and symptoms of ovarian cancer. Unfortunately, there are no early signs, but the signs that we have usually will be present as the disease process progresses. Most cases of ovarian cancer are stage 3 or stage 4 at the time of diagnosis. That's why it's so important for you to be in tune with your body and to be vigilant about noticing these signs. One sign is bloating. That's abdominal distension that often occurs either as the mass on your ovary enlarges or as it makes fluid from having little implants of tumor throughout the peritoneal cavity. So as you can see, it's not an early sign. Pain and pressure in the abdomen and pelvis, that can result also as the mass on your ovary enlarges. Problems eating or getting full quickly, this is usually a late sign. It occurs as the tumor inside your abdominal cavity progresses, increasing the disease in the omentum, which is a fatty layer underneath your stomach and your colon. And as that tumor grows, it presses on your stomach. So when you eat your meals, you get full very quickly. A more common early sign and a misdiagnosis often is urinary tract problem. This occurs with urinary frequency, where you're going to the bathroom more often, or urgency, where you feel like you have to go all the time. That is often a side effect of the mass on your ovary pressing on your bladder, creating this sensation. We're also going to talk a little bit about diagnosis. If you have these symptoms and you go in for your appointment with your GYN doctor, the best way for this to be diagnosed is with 3 different items. One is an exam. This isn't just a general exam, but it includes a pelvic exam with what we call a rectovaginal exam. This is 1 finger in the vagina and 1 finger in the rectum. It allows your physician to feel behind the uterus and deep in the cul-de-sac, which can often be missed without a rectovaginal exam. Imaging, the most common in an obstetrical gynecologic exam would be an ultrasound. Most OBGYNs have an ultrasound in their office. This allows them to look at your ovaries and visualize if there's a mass present. If there's an abnormality on the ultrasound, then they can go to either a CT scan or an MRI. As you know, the ultrasound does not require insurance pre-authorization, so we usually start with that evaluation and proceed to a CT or an MRI as second means, as they do require authorization by your insurance company. Another simple test to be performed is a laboratory test called a CA-125 or a CEA. These are tumor markers. It's a simple tube of blood drawn from your arm and sent off to have these evaluated. CA-125 is a marker for most epithelial ovarian cancers, and this is typically the type of cancer that occurs in postmenopausal females. There are other tumor markers for younger ladies, such as women in their teens and in their 20s. They may have a different type of ovarian cancer called a germ cell tumor, and there's different markers for those. It's important for you to understand that these tumor markers are not specific for ovarian cancer. They can be elevated in benign conditions, even early pregnancy. Endometriosis and uterine fibroids are the most common benign reason for an elevation in your CA-125. And patients who smoke may have an elevation in their CEA. So it's important to understand that they're not sensitive, but if they are elevated and you do have a mass and you're postmenopausal, then our concern grows that there could be an ovarian cancer. We hope this has been helpful to you. If you have questions, you can always go online, and there's an excellent website, www.cancer.gov, to look up other interests that you may have regarding these issues. Thank you for joining us.